It is recording.
Okay, we're at go time, guys. So thank you for coming out today. It's a little bit cold, but I appreciate you coming out. Uh-oh, if everybody could silence their phones, that would be great. So my name is Mary Uter, and I'll tell a little bit of background about myself, and then we'll go into cardiac disease, the cardiac disease process, and how you can protect yourself. Okay. Um, so I was a cardiac ICU nurse for 13 years at Bellevue Hospital in New York City. And we got the worst of the worst there. We were the main cardiac catheterization center for all of city hospitals. So they were sent to us. And unfortunately, because you're working with the general public and people who've never been to the doctor, a lot of times people came in very, very sick. So we got the worst of the worst. So I got great training there. And before I was a cardiac nurse, I used to manage medical practices. So I understand the administrative and the clinical side of the business of healthcare. And I I left the bedside in 2019, just before COVID, to write my book, which is up here on the mantle, Heart to Soul Cardiac Wellness. It's a primer for cardiac patients. And I wrote this because over my 13 years discharging 13,000, I mean, not 13,000, but thousands of people in that time, I was discharging them with a bag of medications, a list of doctor appointments and tests, and maybe a sheet on wound care. And this is after a life altering cardiac event. And my own parents both died of heart attacks before I decided to become a nurse. And so I thought, wow, I'm in the cardiac system. I'll learn so much about how I can heal myself. I learned that the Western medical system can heal you acutely in a very emergent situation, but after that, it's doctor's appointments and tests and medications and refills and the treatment loop, I call it. And this is not how a person returns to wellness. And so I started doing a lot of research on my own and attending seminars, getting certifications on how to heal holistically. And that's what I'm here about today. My passion is teaching people. My passion is sharing information and education and support. I was a psychology major way back as well. So I love people in general, love working with people. Um, the other thing about cardiac patients is they have a tremendous amount of depression, anxiety, fear. They're fearing an anticipatory event. If you were woken up in the middle of the night having a heart attack, how does that make you sleep after that? Mm-hmm. So a lot of this is just not addressed in the current system. And another one of the values that I have in my business, in my presentation and company, and how I work with people is I may say provocative things, or I might ask questions that will inspire critical thinking. And we're going to do some of that today in this presentation. And hello to you at home. Thank you for attending on Zoom or attending later. So let's see. So I'm going to throw a couple of facts at you. So 1 in 3 women will die of cardiac disease. And 1 in 36 will die of cardiac disease. 1 in 36 will die of breast cancer. And so where's all the focus? It's over in the breast cancer arena, right? And not in the heart arena. 1 in 4 people in general will die of cardiac disease. Cardiac disease is the #1 cause of death in our country, yet it's reversible and preventable. What's going on here? Why is it still #1 over all cancers combined? Liver, heart, breast, colon, prostate, you name it. Over all cancer combined, heart disease is #1. It's reversible and preventable. Why is it still #1? Anybody? Go ahead.
What we eat.
It's, yes, part of it, but it's a big business.
Well, the healthcare system isn't set up to work that way.
It's right. It's a sick care system. Right. My program is not taken by insurance because it does everything insurance doesn't want to happen. They want to keep you in the system, paying your insurance and all that good stuff. So, so it's reversible and preventable. It should be a national emergency, but it's not. And that's why not. And, you know, another example is most people have their second heart attack within 5 years of their first. And that's despite going to doctor appointments, taking medications, having side effects, and taking other medications, and going to tests. So something is not working, something is missing in the process of healing. And that is what I dug down deep to find out and to put into a program. So what happens is people get caught in this medical treatment loop. And that's not wellness. Wellness is not taking pills, it's not taking shots, it's not going to doctor's appointments. It's we're born well. Well, ideally, we're born coming into this world in a state of what's called homeostasis, meaning the body is working at a constant level, a steady state of wellness. And over time, and I'm not saying this is your fault, it's not your fault, because our bodies are assaulted daily with so many toxins in the air, with what's in the air. That translates into our soil and into our water. And then we have GMOs and we have glyphosate, we have pesticides. And then if you look at and think about what is in your your medicine cabinet at home, what products do you use on your skin? If you can't pronounce it, you know, chances are you shouldn't be using it. And if you wouldn't spoon any of those products into your mouth, then it's your body is absorbing it. So think of your shampoo. Well, some of you don't probably use shampoo, but shampoos. I love you though. Shampoo. My guys shave. Shampoo, conditioner, soap, deodorant, makeup, shaving cream. The list goes on and on. That's in addition to the other toxins and the toxins in our food. So our bodies are assaulted on a daily basis. And it's no wonder that we're sick, right? And a lot of that turns into an inflammatory process. And that inflammation goes into our arteries. And that's the beginning of heart disease. So let's get back here, because I digress a little bit. So the other thing is too, in that treatment loop I was talking about, doctors are taught to diagnose and then prescribe. That's how they're trained. They're not trained in holistic healing modalities. They're taught to diagnose and prescribe. And I'm not knocking the doctors. I worked with some amazing doctors in my tenure with Bellevue Hospital. And they can save our lives, but they're stuck in the system too. When you go to your doctor, you have 15 minutes with them, and they have to see so many patients an hour in order to float their overhead, their malpractice insurance, all the staffing, all the latest technology. They're trapped in the system too. So that's why you have those 15-minute office visits. And it's sad because people are really being overlooked, and that's how they stay in the system. They don't get better, right? Yeah. So medical error is in the top 10 causes of death. It's lumped under accidents. And I'll give you two examples. One is a dear friend of mine that lived in my building when I lived in Manhattan. She had lung cancer, and she took a medication called Keytruda, which is advertised on TV directly to you. Ask your doctor about Keytruda. What is that? The doctor should know about whatever things are, but the patient shouldn't be coming in saying, hey, what about? It's just backward. So it's business, and that tells you how far and deep this goes. So she had Keytruda, and all of a sudden she said, Mary, I'm falling a lot. And the super installed a special toilet seat that was higher up so she would be okay standing up. And she started to have falls, and I saw her from my apartment get loaded into the ambulance. It was the final time I ever saw her. I talked to her on the phone after that, but she ended up not being able to walk and then being on a ventilator, and that was that. And the side effect to Keytruda is up to and including death. Okay. Another medical error story is a client of mine, Todd, and he we were talking about it had been 2 years since his heart attack. And I said, why don't we see how your heart's doing? And we'll just have a routine echocardiogram and look at the structure and function of how the heart is operating. And he's like, yeah, that sounds, I'm due for a big checkup. Let me go in and see what's going on. So they said, you're having arrhythmias. You need to go to the ER. He felt fine. He didn't know what these arrhythmias were. And he went to the ER and they admitted him. And the next thing he knows, he's having a cardiac catheterization. And now people aren't really educated on what's going on tests, on what's the rationale, what is the risk versus the benefit of this. Why am I having this? Why do I need this? What are the other options? So he went and had it, and they said, oh, your cardiac disease is reversed. And that was because we've been working together. And he didn't call me till after the fact. And I was upset because I could have helped him out, but he didn't want to bother me. And the whole premise of my program is so that I do have a connection with people I work with, that I do make sure they're okay, that they're not left alone and without support. So he was in the hospital, and the next day they had him on the table to do an ablation. So he's on the table, and they said, we're going to abort the procedure. You're not having arrhythmias. So he had 2 unnecessary medical procedures, high cost, and if you're put at risk for infection, not to mention you're getting near the heart, you're messing with things, bleeding. So he had 2 unnecessary procedures. Then they put him on a Holter monitor, which is the first thing they should have done, is the non-invasive to the invasive. So they put him on a drug called amiodarone, which is an antiarrhythmic. It's used routinely post-op open heart surgery or for surgeries because you're innervating the heart, you're cutting open the heart, and that can make it irritable. And to beat irregularly, if you were cut, you'd probably be irritable too. So he was put on amiodarone, and that's for arrhythmias. And then he was also already on a statin, and we were working on getting him off the statin. So what happens, and doctors will not take you off a statin. Once you're on for life. That's what they want. That's the way they're trained. And so they sent him home with a Holter monitor. And I said, let's take a look at your blood work, Todd. So we had a Zoom call, and he brought his blood work up. And we'll get more into statins in a minute. When you're on a statin, which is the most widely prescribed drug in this country, hold that thought in the back of your mind for more critical thinking questions. It's the most widely prescribed drug in the country. When you're on a statin, it can affect your hormones. So looking at his blood work, he was on the statin, which decreases cholesterol. It impacts your hormones. His thyroid was hyperthyroid. And what does hyperthyroidism do? Arrhythmias. So they put him on a drug and went through all that when really the cholesterol was being impacted by the statin, causing the thyroid condition, causing the arrhythmia. Does everybody see this cycle? Yeah. So it's detective work, finding some of these things sometimes. And when you look at blood work, you have a bell curve of where the norm is. But the norm nowadays is the general population. Is the general population, when you look around, does it look healthy?
No.
Mm-mm. That's the general population. So if you're in there, it's not necessarily mean you're healthy. If you're on the outliers, probably a good thing. So that's another thing that needs to be paid attention to. So statins, back in the day, the high for cholesterol used to be 300. Then it was moved to 250. Anybody know what high cholesterol is now?
200.
Right. And same with blood pressure. Now 120/80 is considered hypertensive. Now, when you were young and running around on your front yard like a little gymnast at 10 years old, not too long ago for some of us, your arteries were very flexible. The rest of your body was too. Now, many years later, are your arteries naturally going to be flexible like that? Therefore, low blood pressure? No. So 130s to 140s is okay. That is our body's normal aging. We have so many people that pass out because they're given this artificial low by the heart, by the beta blockers, and they pass out. Then you have head injury, potential bleed to the brain, and a whole mess of other things happening. So the statins, the high was dropped. And why do we think that is? What's the most widely prescribed drug?
Lipitor?
Statins. Statins. And they dropped that threshold. Why? So they could sell more. So they could put everybody on it. If you go in a cardiologist's office, you're going to leave with a prescription for a statin. It's almost guaranteed. So it's the most prescribed drug in the country. Is everybody having a little bit of eye-opening so far? Okay. So is your body deficient in statins? Is your body deficient in beta blockers? Is it deficient in GERD medications? Did you come out of the womb deficient in all that? No. Maybe now you're deficient in magnesium, potassium, iodine, things like that. But our body isn't deficient in pharmaceuticals. So our body actually makes cholesterol on its own. Cholesterol is a protective mechanism. The liver makes cholesterol. So statins decrease cholesterol. And when that happens, it decreases vitamin D. Vitamin D is necessary for immunity, for protection against cancer and a lot of diseases. When you interrupt D and cholesterol, as we discussed, you're interrupting the hormones. A lot of men are low testosterone now. And by the way, what is the first sign of cardiac disease in a man?
Chest.
Do you know? Erectile dysfunction. Why is that? Because we are blocking up the microcirculation first before the macrocirculation, the larger vessels. So a lot of men are reaching for the little blue pill when they really need a cardiology workup. And then we had people coming in saying, "Oh no, I didn't take a blue pill." So the blue pill vasodilates you. So what happens is when they're in the emergency room, they have chest pain and they say they didn't take it, and then they're put on nitroglycerin, their blood pressure bottoms out. And then they have to be put on in the ICU and put on IV pressors, medications to increase the blood pressure in an emergent situation. So if you do tangle with a little blue pill and something happens, just say, "Yes, I did. I had it," okay, to avoid all that. So statins also decrease insulin. We talked about hormones. Insulin is a hormone. So when you decrease insulin, what's happening to the blood sugar in your body? It's going up, right? And that makes you insulin resistant, and it leads to diabetes. So statins, direct pipeline to diabetes. And what happens in diabetes, and why is it so closely linked to cardiac disease? You've got sugar in your blood. So imagine you've got, here's my artery. Imagine you have this is the normal pathway. It's like a nice freeway. Okay. Like I lived in LA, so this would be the 405 freeway at 4 a.m. and a beautiful day. Nobody's on it. Then over time, you start to get all this plaque, cholesterol, all that in there because it's patching up damage. So if you think of red blood cells as cars on the freeway, all of a sudden you've got less lanes to navigate in. And then if you have diabetes, you've got pancake syrup that you're driving through. You have thick, sludgy, sugary filled blood. And what happens with the sugar is it's like shards of glass on the insides of your arteries. So when you have damage to the insides of your arteries, cholesterol comes as a second responder to repair the damage. Cholesterol is the good guy. It's like blaming the fireman for the fire that he's putting out. Cholesterol has been bastardized to be the bad guy, and it's not. Okay. And the first line of defense is collagen to repair. So if you're thinking of a stream, does silt and sediment and algae settle in the faster part of the stream or the slower part of the stream?
Slower.
Right. So we have arteries that the blood moves twice as fast as our veins. Why aren't we getting cardiac disease in our veins? Because the arteries have more force because they're coming out from the heart, number one. And number two, so they're more prone and fragile. And number two, the shards of glass, they're injured easier. And also, so when you have that force and you have blood in it with the shards of glass with the very low density lipoprotein, those can actually get through and calcify the outside of your arteries as well. So we have quite a conundrum here. And the thing we want to do is protect the microvasculature. We want to keep our blood flowing, not sugary and syrupy, keep our blood pressure at a normal level for us. Okay, basics. So that's how taking a statin can increase cardiac disease, because you're keeping the sugar up in there. It's ruining your cell membranes. Our cell membranes are made of a lipid layer. Lipid is fat, so all of our cells have a little lipid layer. It also decreases muscle function. So if anybody's on a statin, sometimes they have muscle pain. And that muscle pain is because the statin is depleting an enzyme called CoQ10. And CoQ10 is a good supplement to take if you are on a statin. But by depleting all your muscles of CoQ10, you're also depleting the heart muscle. So in essence, statin is leading to heart failure by depleting the heart of the ability to function optimally and pump optimally. Statins are toxic to the liver. So when you are on a statin, you have to get your liver enzymes tested to make sure there's no fallout. And it decreases the repair of blood vessels because it's impeding cholesterol's ability to come in and patch up the potholes. Unlike New York City, where they never get patched, or rarely. So cholesterol's not the bad guy. Can we agree on that? And the big clincher here is I told you to park in your memory bank. It's the most widely prescribed drug, right? So we're taking away cholesterol from what organ uses cholesterol the most? The brain. Okay, so what disease process is now rampant in our country?
Alzheimer's.
Is everybody on board with statins anymore? No. And there are ways that you can even all this out. Doesn't have to be all cholesterol and a statin. There's ways naturally you can help your body heal. So when you take medication, it's like, does everybody have a car? Knows what the car dashboard is? Okay, so on the car dashboard, if your check engine light goes off and you take duct tape and you cover up that light, is the problem with the engine still going on? Yeah. You just covered it up with tape. That's what medications are doing. The actual cause for what's happening and why your body's changing and having this high blood pressure, having the cholesterol, having diabetes, having all these problems, there's a cause behind it, and it's being covered up by the medications. So your labs, in essence, are your body on drugs, not your body on its own. Your lab results are fake. They're not you. It's your body on drugs. Your vital signs, it's not you. Healthy people don't need meds, do they? Sometimes they need a speed bump to get over things, but the goal is not to be on meds. To end your life where you're like, damn, I felt great every day. I have vibrancy. I feel so good. And so many people are depleted from their vibrancy. And it's been taken away. Down to the cellular level, they're exhausted, where their mitochondria, their cells are just exhausted because they're tired of fighting toxins. They're just have no nutrition. They don't have enough rest. There's stress. So stress causes the heart attack. Stress is really the cause for the illness. And stress from what we eat, what we have going on for our body, our environment, and our mentation. And all this, like I said, this is not your fault. I call this sad, sad Sam. And we talked about it a little earlier with my friend Joni and Kaytruda. So everybody's on the standard American diet, which leads to the standard American diseases, which leads to the standard American medications. And those are brought to you by the standard American media, sponsored by the standard American pharmaceutical companies. I have something on my Instagram account, and it shows all the TV shows sponsored by Pfizer. Crazy. It's crazy. So medicine is big business. So people ask me, Mary, what is the number one thing I can do? Walking away, like, to help my body. And they don't want to hear this, and I'm glad you asked. Thank you for asking me. They don't want to hear this. It's getting rid of dairy or minimizing dairy. And here's why. Did anybody have children in this room? Okay. Did you nurse them? Well, you didn't nurse them. Okay. So at a certain point, you stop nursing your child, as does nature. Cows, sheep, goats, they stop nursing their babies. So we're taking milk from another species. They take the baby away and give it formula. We put the mother on the machines, and the mother's grieving. So you've got adrenal cortisol and adrenaline and sad hormones in that milk. And then they get infected. So that's why it's heated and pasteurized to get rid of the bacteria. And there's a protein in milk called casein. And casein has been directly related to prostate and breast cancer. And I grew up drinking tons of milk. My mom was a teacher, and before that, she was a nutritionist, and my dad was an engineer. And I had not just 3, probably 4 square meals a day, meat every day, milk every day. We had dairy milk delivered from a dairy with the little guy with the milk thing. You might remember it was lovely days, lovely times. And so I always gave my daughter yogurt. I always had yogurt. And then in 2008, I had not a cardiac event, event with cancer. And I started doing the research. And there's a book called The China Study, written by T. Colin Campbell. He's a researcher from Cornell. And he did a study and showed the correlation between casein and prostate and breast cancer. So what we're doing is we're taking another species product full of their hormones and antibodies and fats meant to grow a bovine very quickly. It's not meant to grow a human. In fact, you can't feed a human infant cow's milk. It will cut into their gastrointestinal tract and make them bleed. So what does that tell you? And then some people are lactose intolerant. You're not lactose intolerant. Your body is saying, this is for a baby cow, not for me. But people will choose to pop a pill to have their lactose. And it's just not meant for you. It also is addictive. That's why people cannot separate themselves from their cheese, and a scalpel may need to one day, because it has something in it that converts to casomorphin. And casomorphin attaches to your opiate receptors in your brain. And so that is the addictive component. So I'm not saying don't ever have it again, but be mindful. Don't have it every day. Make it a special treat. Understand where it came from. Maybe bless it. Thank you for coming to me and nourishing me however you can. Another reason is dairy is acidic. It's inflammatory. And inflammation is one of the reasons that we get cardiovascular injury. And when you have dairy, it's acidic. So your body is a chemistry set and your body wants to buffer that acidity. So what does it do? What does your body do? It leaches calcium from your bones and teeth to buffer the acidity of the milk. How about that? So you're actually depleting yourself by having milk.
Yeah, and we certainly all grew up with, milk builds strong bones, but it really doesn't.
So if they're telling you milk, it does the body good, are we going to believe these agencies anymore? If it's telling you don't eat meat, are we going to believe these agencies? If it's telling you don't eat eggs, eggs are a whole food that a chicken eats to grow. It's got everything in it. It's got things, choline. It's got things that are so good for us. I myself was vegan for 5 years. I was on that whole bandwagon. And in doing my research, and you learn new things or new studies come out, it's that is okay. And up here, I'm new here. I'm in the process of moving up here. But up here, we have beautiful, beautiful animals raised humanely, eating grass on these beautiful pastures. They're healthy. And that's something that we can enjoy and be thankful for and use to fuel our body. Because there are a lot of nutrients in meat that vegans have to supplement. And even then, it's not the correct supplementation. So everything again is balance. I'm not saying go out and have hamburger for lunch and steak for dinner and eggs for breakfast tomorrow. Everything is balance, right? And so that is the number one takeaway is getting dairy off the plate as much as possible. And you'll feel better and you won't even realize you had a brain fog after that. And I know you have a nice cheese store right here. I've been to it. But take it easy on that a little bit. And then heart disease doesn't start in the heart. Like I said earlier, it's a whole body issue. Any disease process is. The thing is medicine has said you have a heart doctor, a lung doctor, a liver doctor, a kidney doctor, a prostate doctor, GI doctor, and so we've siloed medicine, and there's nobody really looking at the whole body, and they don't have time. They're just looking at that organ, and we need to look at the whole system and the blood work as it relates to the whole body. And what I do is I start with the mindset. I created my program. I wrote the book, which is a primer, and created my program off of that. The book is from a phone call I received from a friend of mine. She was my college roommate. And she said, Mary, I've been told I have to have open heart surgery. I have to have 2 valves replaced. And I don't know what to do. I'm so scared. Everybody says you'll be fine. I don't feel that way at all. And I said, I got you, girl. I got you. And so I documented the whole process of what we went through, including up to and including the caregivers, what they can expect when you're in the hospital, what you can do to prepare for your hospital, for any hospital visit, what you can do to take with you to make you more comfortable, how you prepare yourself at home afterward. So if you've had open heart surgery, are you going to be able to unscrew a jar? You're using all these intercostal muscles. You can't. Are you going to be able to reach up to a top shelf? No. So you have to prepare your house for your return. So we worked all the way through all the steps, including a plan for who was going to bring food to the house for the kids when, who was going to be with the kids. So we mapped out everything to the umpteenth detail for her. And that is the basics of my program is not just preparing, but it's it's talking about meat, talking about dairy, talking about the cardiac Bermuda Triangle, which is hypertension, hyperlipidemia, and hypersugar, which is diabetes. So it's high blood pressure, high cholesterol, and high sugar. That is the cardiac Bermuda Triangle that causes the most. When you get in there, it's hard to get out. So we worked on that and tactical strategy for nutrition. What you can eat so that every meal is medicine. So when you walk away, it's not like you're being depleted. But for example, one of my clients loved sweets every day. And I said, okay, how about we do this? We make you nature's caramel. And we take medjool dates and you tuck, and that they are antimicrobial, antifungal, antibacterial. They're fiber. They feed the good bacteria in your gut. And then have a couple of squares of dark chocolate, 70%, that's full of magnesium, which your heart loves and helps to maintain a proper rhythm. And then selenium, which is in Brazil nuts. So you have some Brazil nuts with it, and that's great for your thyroid. There, you just had a treat that when you eat it together, it tastes like caramel. But did you see the medicinal value in that? So that's the tactical strategy. It's no diet. I don't like the word diet. I like the word nourishment. Diet is so punitive. It's like, you can't do this, you can't do that. No, you can. One of my clients canceled his open heart surgery, reversed his diabetes, reversed his heart disease, had 16 medications a day, now has 0. And he still has his Scottish egg breakfast every Sunday. And that's with me. And his labs did not change. He's still golden. He looks great. So, did we talk about the questions to ask your doctor when you're put on a med? Okay. Here's another takeaway for you. When you go to your doctor, ask your doctor, what is the rationale for me to be on this medication? And what is the process to get off it? And they'll buck you, like I said, especially with the statin. I've dropped my cholesterol. I've changed my way of living, my lifestyle. What is the rationale for me to stay on this? There's no rationale, but they just want you on it. It's like a protective banister that they're holding on to. And you really have to advocate for yourself to come off medications. So what is the rationale for me being on it? And why am I on it? And what's the plan to get me off it? Okay. So where everything starts is mindset. So a lot of people we talked about live in stress. Things are going on in your head. We're not present in the moment. We're dialed out somewhere else. Being present with what you're doing, not multitasking, being kinder to your body. We run our bodies like taxi cabs in New York City. We're just running over the potholes and we're working 24/7. And it's time to stop that and get your mindset in order. And my client I just told you about, my superstar, he did not want to meditate. He did not want to do any of the mindful work. He didn't want to get in there. And some people are afraid of it. And his wife said, then why did you enter this program and pay for it if you're not going to do it? So the next time we had a Zoom call meeting with the group, there she is sitting next to him. And he said now he can't start his day without meditating. It has changed his life so much. And that's an awesome thing to hear. The next thing we look at is your gut health. So if you're anxious, anxiety, fearful, depressed, angry, that's going to drive your cortisol levels up. And what that's going to do, cortisol works in tandem with insulin. Your insulin's going to go up. And so when your insulin goes up, you become insulin resistant. So your blood sugar goes up. You're starting to see what's going on here with this little path. So we have to heal our mind, our mindset, and calm ourselves. And what we're looking at there is to engage the parasympathetic nervous system. We have 2 nervous systems. One is excitement, and excitability is called the sympathetic nervous system, and the other one's the parasympathetic rest and digest nervous system. We want to engage that. We use tools to engage that. And we'll do one before we leave today. I'll guide you through it. So we use that to engage the system. You want to also increase your heart rate variability. Heart rate variability means my body noticed the wind blowing, and it might have ticked upward in my heart for a multi-millisecond. Realizing there's no threat, it comes back down. Some people live in that threat state all day long, and that is so toxic for your heart. You're stuck in a constant heart rate variability. You want your heart to be able to chill, to go down. You want to be able to put it in chill mode. So we concentrate on the mindset. If you don't have the mindset correct, we talked about the insulin, it can lead to diabetes or insulin sensitivity. And what insulin sensitivity is imagine yourself coming home, sitting in the chair. He's had a rough day. It's Friday night. He just opened a beer, has the remote, and is watching his favorite TV show. His wife, the pancreas, is in the kitchen, and she is yelling at him to do this, do this, do this. And the do this, do this, do this is insulin. And this guy over here in the chair stopped listening a long time ago. So the moral of the story is it's insulin resistance. The insulin is what allows glucose into the cell to give it energy. That guy's sitting there on the chair, not doing anything and not listening. That's what happens to your cell. So improving the mindset, getting into your parasympathetic nervous system, and then healing the gut. If you are